Good afternoon, everyone. This week, we saw a dramatic rise in cases in both Grey Bruce and Ontario. Ontario recorded over 30,000 new cases, while Grey Bruce recorded 121, double the number of new cases from the week before. 22 of those new cases were right here in the town of the Blue Mountains. All of these case numbers are unprecedented. Currently, there are 33 active cases in the Blue Mountains. Hospitalizations, patients in ICU and on ventilators in Ontario all saw dramatic increases, and 152 Ontarians lost their lives. In response to the dramatic rise in cases, the Grey Bruce Health Unit on Wednesday declared a critical threshold of COVID-19 cases had been reached in Grey Bruce. They stressed the importance of everyone staying at home unless absolutely necessary. Limiting your close contact to members of your own household is the best way to keep yourself safe. The health unit reported that the surge in cases was mainly related to 2 social gatherings and that variants of concern had been identified. The health unit anticipates that contact tracing of these cases will result in identifying 300 to 500 close contacts, which could challenge the health unit's contact tracing capacity. Health unit is asking the public to help. To be most conservative, everyone across Grey Bruce needs to consider themselves a carrier until the health unit reaches all cases and their contacts. Yesterday night, I joined Dr. Ara, our medical officer of health, on CP24 to discuss these developments. The video is available on the CP24 website and will provide additional information on what is going on. Yesterday, the health unit declared a community outbreak in eastern Grey County, which includes the town of the Blue Mountains. The cases have been identified as a variant of concern. The sources of the transmission are identified as individuals not following provincial orders by visiting others while symptomatic, as well as attending large social gatherings. The issue is worsened by individuals being untruthful to public health contact tracing and case management inquiries, resulting in delays in isolating close contacts. There are 21 confirmed cases, plus a significant number of probable cases and high-risk contacts related to this outbreak. The outbreak is widespread, but is centered in the communities of Thornbury, Clarksburg, Meaford, and spills into neighboring Simcoe County. COVID spreads from person to person, and one person acting irresponsibly or a single social gathering can lead to a large number of cases. For over a year now, the huge majority of us have followed all public health advice and made sacrifices to keep COVID at bay in our community. In spite of the fact that we have had a large number of visitors, we have had among the lowest case counts in Grey County and South Georgian Bay. I am deeply disappointed and angered that the reckless actions of a few irresponsible individuals have now put the safety of our community at risk. We are all tired of COVID, but that is no excuse for the reckless behavior which has let COVID take hold in our community. One can only hope it does not result in any deaths. The size of this outbreak is a daunting challenge for our health unit. In addressing this situation, the Grey Bruce Health Unit has employed all staff with appropriate training that are available to work on contact tracing and case management. I'm told as of 5 p.m. yesterday, initial calls to all cases and their close contacts have been completed to let them know they are cases or contacts. Another part of the team is now following up with the above to complete risk assessments, to provide risk-based recommendations, and to identify the close contacts of the close contacts. Determining who has had a close contact is a decision that can only be made by the public health unit. Anyone at heightened risk of COVID-19 transmission due to close contact to a person with COVID-19 will be contacted by the public health within 24 hours of the investigation. The health unit will direct those considered at risk regarding testing requirements and recommendations. Contact tracing is a very effective tool to contain COVID-19 outbreaks. And it is the effective contact tracing by the health unit that has kept COVID under control in Grey Bruce over the last year. By contacting all close contacts of people who tested positive and having them self-isolate, it is possible to put a ring around any outbreaks and prevent future spread. The active case count in the town of the Blue Mountains is higher than it has been at any stage of the pandemic. If you are eligible to be vaccinated and have not yet been vaccinated, it is important that you register immediately to make sure you are vaccinated as soon as possible. Please register using the provincial online booking system for COVID-19 vaccinations at ontario.ca book vaccine. Those without access to the internet can call the toll-free number 1-888-999-6488. If you can't find a clinic near you, new clinics are being added as vaccine supply allows. Please keep watching the Health Unit website for the updated list of clinics. Have a great weekend and stay safe.